Hello, my name is Krista Droback. I'm the Executive Director of the Alliance for Connected Care. I'm so pleased to be here today. I am a fellow migraine sufferer. I got my first migraine with Aura when I was 12 years old, and I'm sure, like many of you, didn't know what to do. So I'm very thankful that the Coalition for Headache and Migraine Patients is out there to help patients like me and my family when I was young. So today I'm here to talk about telemedicine. As you know, telemedicine really skyrocketed during the pandemic. Part of that was obviously the fact that people didn't want to leave their homes, but over time, it really became about convenience, access to care. And I do believe that many more people got access to care because telemedicine was available, and we're working hard to keep that available. The Alliance for Connected Care is a coalition of industry, but also advocacy groups. We have on our board tech providers like MD Live, American Well, Amazon. We have hospital systems like Ascension, Intermountain, MedStar, Stanford, and then we have a huge group of advisory board members, of which CHAMP is on the advisory board, but we work with mental health, Parkinson's, multiple sclerosis, ALS, epilepsy, all kinds of groups that have members who are benefiting from telemedicine. So as you may know, I mean, 28 million people in Medicare access telemedicine in 2020, and the numbers remain very high. Patient satisfaction numbers are very high, upwards of 66%. There have been quite a few surveys, all of which held firm that patients like it, providers like it, caregivers like it. It's increasing access. Telemental health has actually been a real shining star in the pandemic, and I know that many migraine sufferers also seek mental health services, and so that has been a really good use case. Interestingly, telehealth has reduced stigma related to pursuing mental health services, so that's another reason, other than access, to really keep it legal and allowable and reimbursable. The other things that were made available during the pandemic were prescriptions for some behavioral health services. The 35 million Americans who have high deductible health plans were able to receive telehealth services through first dollar coverage. So if you had a high deductible, your employer was able to offer you first dollar coverage. So you could get telemental health services or primary care services or services from your migraine provider, your neurologist, all through telehealth without having to first meet your deductible. And those services are available until the end of this year. So we're working hard to make sure that in 2023 and beyond, that people with high deductible health plans will continue to be able to have access to telehealth services before their deductible is met. Other things that were made available, there were practitioners like physical therapists, occupational therapists, speech therapists that were able to practice telehealth during the pandemic. Mm-hmm. There were lots of practitioners that were able to practice across state lines, which is another thing that we're working to preserve. Right now, the provider that you see has to have a license in the state where you are located. We would like to see a world where the providers can provide services across state lines, and so the license would be where the provider is located. So that is a big issue at both the state and the federal level. So what I would love to say today is that all of us have a role in making telemedicine policy permanent so that in the future it continues to be an ongoing option for all patients. So to the extent that you are interested in getting involved in Washington or adding another bullet to your talking points when you're up on Capitol Hill or talking to Biden administration officials, tell them how important telehealth is to treating migraines and how it has improved access during the pandemic for you, if that's true. Add a personal story about telehealth for yourself. We need to really hold members of Congress' feet to the fire on making these flexibilities permanent. In this last bill that Congress passed, we only got 151 additional days after the pandemic ends to access telehealth services for Medicare beneficiaries. That's not enough. We need to make this permanent. So, to the extent that you're up on Capitol Hill or talking to other policymakers around town, I hope that you will add telemedicine to your list of advocacy principles. So thank you again for having me here today, and I hope the rest of your conference is very productive.